Well, good evening. I'd like to call to order this special meeting work session of the Newport News School Board for Tuesday, March the 9th, 2021. On behalf of the members of the school board and the superintendent, I welcome each of you joining us. A quorum is present to transact the business of the school division. The COVID-19 pandemic has had an unprecedented effect on all of us. We're adapting to this new way of conducting business, and the school board is as well. School board members are participating in tonight's meeting virtually. Dr. Parker is joining us from the administration building. Staff and visitors in the auditorium are socially distanced in compliance with the governor's orders. We will begin tonight's meeting with a pledge to the flag. Madam Vice Chair, would you please do the honors?
Everyone please stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please be seated.
All right. Thank you, Madam Vice Chair. I believe tonight on our agenda, we have a presentation. Dr. Parker has a presentation on the recommended budget for fiscal year 2022. Dr. Parker?
Thank you, Mr. Chairman. Yes, I do this evening. And first, I'd like to also say good evening to everyone who's viewing in, not only our public, but also our staff. Any staff who are online this evening, I'd like to say thank you for a great last few weeks as we welcomed our students back to in-person instruction. We appreciate everything you do every day to make our schools do the magic that our students need. So thank you so much for all that you do for our kids. Mr. Chairman, Vice Chairman Searles Law, and members of the board, this evening I will present my proposed operating budget for FY22 this evening. And joining me this evening is Mrs. Mary Lou Rousseau, our Assistant Superintendent of Budget and Services, who will present our compensation and health insurance information later in this presentation. So let's get started with an overview of our actions leading up to this evening. For those who are viewing this evening who may not be familiar with budget development, we began our planning for the next fiscal year as early as November by communicating with our various school division departments and soliciting input on budget priorities at the building level. By December, around the same time that the governor usually releases his proposed state budget, our budget team is busy consolidating our initial estimate of budgetary needs for the next fiscal year. Our goal each year is to develop a needs-based budget for our school division that provides the resources needed to maximize our service to students in our community. In January, we have traditionally scheduled our work sessions with our school board to gather their input and feedback on our identified budget priorities. Around late January or early February, we normally meet jointly with the City Council as well to discuss our priorities, which is also an opportunity to set the table for future budget discussions. Leading up to this evening, we've held a community budget input session and met with the superintendent's budget advisory committee as well. And I have had the opportunity to meet with the city manager prior to this meeting. Next slide. So we'll begin our presentation this evening by talking about the current budget, FY21 budget detail. So we can obviously give you a broader comparison of this year's budget compared to our proposed budget for next year. So looking at the FY21 budget, this pie chart shows our major revenue sources for this fiscal year. You can see that the state provides roughly 64.2% of our revenue that makes up our operational budget, and the city provides 34.3%. Our total operating budget of $330.3 million is shown here, and in this $3.1 million, or less than 1%, comes from federal sources, and approximately $1.9 million comes from other sources, such as fees and other collections and so forth. It is important to mention that this does not represent the revenue from major grants or awarded funding, such as Title I or other programs. There are additional revenue sources that do not make up our operational budget, which are not reflected in this pie chart. So let's look at the budget by function, which is very important because we're leading up to how is our money spent. This pie chart here shows this year's budget by function, and as you can expect, instructional services, instructors, which is our primary business, makes up 72.6% of this year's budget. Operations and maintenance includes plant services, custodial services, security, and warehouse services. So when you look at this pie chart here, you can see that the bulk of our budget is directed towards providing service to instructional service to students. But we have to have the supports. The buses have to run. We have to have the facilities, the technology, and those types of things in order to make our full instructional program. But obviously, this budget supports where the bulk of our money goes. And this next slide shows it even more in a broader comparison, because this shows by expenditure, the bulk of our budget is spent on people. And that's what education is about. Education is about the teacher in the classroom and the student in the class, right? And the support service, the bus driver, the cafeteria worker, custodians, and school counselors. So our budget reflects where our money is, and it's mostly in personnel. So salaries represents around 1% of our operational spending. Benefits associated with those salaries, 25%. And then you have the non-personnel expenses, which we'll talk about in a moment, technology, operations, those other expenses, transportation. Those make up 14% of our operational budget. So moving on beyond the budget detail for FY21, the other driving factor this year, something that we want our board and our community to be aware of, is how were we impacted by this pandemic. In terms of budgetary or operational spending, the biggest difference this year between this year and last year was obviously the drop in enrollment as a result of the pandemic. So as we look at this fiscal year, we had to compensate for the impact. As we looked to develop this budget, we had to compensate for the impact the pandemic had on student enrollment this school year. Student enrollment is a primary driver in terms of state funding that we receive each year. As student enrollment increases, we receive the appropriate increase in support from the state. However, we were very concerned this year when we saw the significant decrease that was attributable to the pandemic. As you can see, we relatively remained flat from FY16 all the way up to FY20, somewhat flat. And then this year we saw a reduction of almost a little bit over 1,100 students. So with that being said, we rather than developing a budget that would reflect that reduction in 1,100 students, which would be a significant revenue loss from the state, we know that once we get near to full operations, hopefully full operations for the 2021 school year, we're expecting to some of those students to return back to us. In fact, we're counting 652 of those lost students back into the budget for FY22. So we did not account for the entire loss of this school year due to the pandemic, knowing that some of those students, once we get back to the to fairly normal operation, will return. We're hoping all of them return, but we had to put a realistic number in there to make sure we could balance our budget. So we attributed for additional 652 based on this year's current enrollment. So where did we lose most of our students? If you look at the next slide, this slide gives you a great comparison view of where our enrollment losses and increases were for this year due to the pandemic. As was the case across the state, so they're consistent with local school divisions and across the state, everyone saw enrollment losses as a result of the pandemic. We saw our most targeted drops were in pre-K and kindergarten. Now we feel that bodes well for us moving forward, because in many cases these students may have had other options other than going to public school during this year during the pandemic. So we are expecting once we get back to normal, to full operations next year, we'll see a sizable number of those pre-kindergarten students returning back to Newport News Public Schools. So at this point, we'll talk about the outline of our budget presentation based on our priorities. As we present a budget this evening, it's important that we begin with the focus with a focus on our key priority areas that align with our strategic plan, Journey 2025. If done well, an operating budget should be a reflection of an organization's values and therefore aligning our budget priorities with the areas of the strategic plan: student success, student and staff wellness, employee expertise, enhanced partnerships, and stewardship of resources enables us to present a budget this evening that is not only needs-based, but it also is reflective of the key priorities of our organization. Our budget priorities are broken down this evening into 4 key areas: compensation, increased staffing, technology, and infrastructure. We will begin with our compensation priorities, which will be presented by Mrs. Rousseau.
Thank you, Dr. Parker. Good evening, Chairman Brown, members of the board. As Dr. Parker has said, we have our compensation as a top priority often, and it does really reflect value. We know the importance of attracting and retaining the best staff to work with our students, and so we've been working on this for a while, and we want to share with you tonight the progress that we've made and what we propose to you for next year. So starting with this slide, which is a familiar slide to you, it shows for the beginning of this year where we began in terms of how our salaries for teachers compared to other local divisions. And as normal, we see bachelor scale positions at the top and the master scale at the bottom of the slide. So you can see, and we're highlighted in yellow, so it's easy to see where we rank with other divisions for various points on each of the teacher scales, starting on the left with our new teachers and moving to the right with our most experienced teachers. Like many school divisions, we did not do salary increases at the beginning of the year. A few divisions did, but most did not, just not, as we waited to see what was going to happen with state revenue. So if we move now to the next slide, Michelle. We were able to make some adjustments in compensation. We're actually doing that as we speak for this month. Once the state revenue picture for this year became clearer, which really didn't happen until December when the governor released his budget, which it always includes Caboose budget, which is the expectation year. And in that, we saw that there were going to be some adjustments for this decrease in enrollment that Dr. Parker shared with you. And we had hoped that the General Assembly would address that in their session in August through October, but they did not. They pushed that forward to the current session. So we really needed to wait to see what was going to happen with revenue before we could make compensation adjustments. But the good news is the budget looked pretty good. The revenue did not take the dive that they expected, and we were able to make some adjustments in compensation. So as you know, reported to you last month, we did provide a $750 bonus to all staff in February. We are in the process now of preparing payrolls that will increase salaries by 3% for all staff except directors and above, who will get a 2% raise. Those raises are effective in March, so whenever folks are paid in March, they'll get that 3% raise. And also, and we're going to talk a little bit more about compression adjustments tonight, our teachers will receive more than 3% because they will have compression adjustments made in their March pay. And then in April, we will do experience adjustments for some of our support staff, specifically our instructional assistants and our clerical staff. And those are the 2 largest groups that we have yet to do experience adjustments for. That will happen for them in April of this year. So that's what we were able to do this year. And then on the next slide, we have another view of this salary comparison with the adjustments made that we just were making. And we have our HR staff has looked to see what other school divisions have been able to do, and many other school divisions were also able to do adjustments at this point in the year, whether some did it in January, some February, some March, as we're doing. This is where everyone will be based on those adjustments. And you can see that we've made some progress. We've been working on this for a while, so it's good to see the progress. I do just want to say that some divisions have not yet done adjustments and will not do them until next year. And because of that, they're doing a larger. And so when we look at this next year in July or August, once all those adjustments are done and we know where everybody's falling out, the rankings may change again as they do. They're very fluid. But this is just really an indicator of how we're doing. And also, as you look at the ranks, where we're ranked, in some cases there are just a few dollars between school divisions that are close together on this. But just an idea for us to see how we're doing compared to other divisions with respect to salaries. So that's what we were able to do. Let's look at what our plan is for FY22. We plan to do another 3% salary increase for all employees, and we are going to do some salary scale adjustments. This adjusts the beginning pay for each of our salary scales. Those will be raised by 1.5% for next year. And then we are going to continue our work on compression adjustments for teacher scales. And by doing that, our teacher raises will range from 3.7% to 6.7%, significantly more than that we're proposing for all employees. So the next slide will help us work through that a little bit, and I apologize in advance. It's a lot of numbers, and so I thought it might be helpful if we work through it a bit. Some of you will have seen this slide in previous years, but it is a little dense. So let's talk about what it tells us. So first of all, it shows teacher salary increases from FY16 through FY2, and you might wonder, why did we pick FY16? Well, that's the year that we began the compression adjustment work that we are nearing the completion of. And so that's why we chose 2016 as the starting point. So let me explain how this works. Let me say first that we did compression adjustments in each of these years, except for 2018 and 19. You see kind of in the middle of the chart, there's a 4% rate right down the center of every level of experience. And that was the year that we did a 4% raise for everyone. So there was not enough funding to also work on our compression adjustments. So we took that year off of compression adjustments, but the other years we have made some progress. And at this point, where we are in our progress, we are on a march to try to get 1.5% between each year of experience on our teacher scale. So with what we're proposing to you for next year, we would have each year of experience from 15 through 30, 1.5% apart, and we're very happy about that. And for the years of experience from 1 to 14, we are at 1.25%, so we are really very close. And I'm hopeful that in the next budget cycle, or possibly two, at least in the next state biennium, we'll be able to have all of our teachers 1.5% apart based on years of experience. And that's been a march that we've been on for a number of years. So let's look at what this slide tells us, because there's really a lot of information here. Down the left, at the first column, it says years of experience, and so that would be the years of experience for our teachers. And so then as you work across the page, each year you would see what percentage raise teachers got with that year of experience. At the top, you see some percentages, and those are the general increase that was given on that particular year. And as I mentioned, for example, in 2021-22, we're proposing 3%, and for 2020 did 3%. You can see 3% at the top of each of those years. So that's what that indicates. And if you look at the total increase for all the general increases for the 7-year period of time, you can see that it's 19%. So just kind of keep that number in mind. And we're going to compare how our teachers did compared to that 19%. So if you look then at a teacher, let's say a teacher joined us in August of 2014. Many of our teachers joined us in August. Say our first teacher joined us in August of 2014. And so they would have 0 years of experience, and they're starting at that first yellow filled space. And then in 15-16, they get their first raise, and they get 3.5%. Now, the general increase for everyone was 2%, as you can see at the top of the column. But because we did compression adjustments that year, and because that year we focused our least experienced teachers, that teacher with 1 year of experience would have gotten a 3.5% raise. The following year, they'd have 2 years of experience, so you see how this kind of moves diagonally down. So the next yellow box says that the second year they would have gotten 3.7%. And so it goes across the slide until you get to the total column, and you can see that that particular teacher who joined us in August of 2014 received raises totaling 24.4%, again, assuming that next year's budget that we presented to you is approved by the board, as compared to the 19% total of the general increases. So let's look at a teacher who perhaps had 15 years of experience. You can see the 15 years highlighted in yellow. 15 years of experience in 2014 would have gotten a 3.6% raise in 2016, and then 4.8 again across the page. You can see that that teacher that would have had 15 years of experience in 2014 would have received raises totaling 30.5% over that 7-year period, as compared to the 19% general increases for all staff. So I think by anybody's standard, that's a pretty good outcome for our teachers. And you can see that all of our teachers who have, let's see, where are we? 22, experience and above, are in a position to get 6.7% raises for the upcoming year. Also want to mention another thing that I think is interesting to look at. You know that the state budget provides 5% for the biennium in terms of raises. But I want you to look at what our teachers are going to get. So our teachers with just 1 year of experience will be getting 7.4%, and then ranging up to 11.9%. So I think that's a really great outcome for our teachers. We know that this is work that we needed to do. We're very pleased about where we are, and we know we have a little bit more work to do. The state has more work to do with regard to teacher pay and making that more competitive with other states in the country. And we certainly want to do additional work with our scales, but I think it is a moment for us to celebrate the work that we've been able to do and money that we've been able to put in teachers' pockets in Newport News. So we're very pleased with that. Okay, I think that's what that slide can tell us. And I'm sure you're tired of looking at it. So let's move on to the next one, Michelle, if we could. So another group that we've worked tirelessly with across the past few years is our bus drivers. Our teachers do really important work, but we have to get the children to school. And many of our children ride the bus to school, and so our drivers are another very important employee group. So we have worked on our drivers' pay. These are beginning pays that are shown here, and this shows how our beginning pay by year from 18 to 21, the adjustments that we're doing this March, compare to other school divisions. And if you see in the bottom, there are some notes about the work that we've done in each particular year. And notice that we had done some work in 17 and 18, only in 19 to be undone by other divisions who are just as desperate as we are for drivers. And so this is something everybody's watching. So these things really move. As I mentioned earlier, they're very fluid, and we see these move all the time. So our HR staff works on this. They look at it. They bench our positions with other districts on an ongoing basis throughout the year. So kudos to them for the work that they do there. But you can see that where we expect to be with the adjustments that we're making in terms of March this month, our starting pay will be at $15.04. And then we'll make another 3% adjustment for next year, what everybody else is going to do, so we really can't show you what that comparison will look like until that information is available, and that'll be several months from now. So we have done some work on our drivers' pay, and we're pleased with that. And again, it's another group that we have to keep watching. And the next slide shows some additional staff, support staff positions that also we've been working on. You can see the several groups that are here. And I want to mention a couple of things. One, each of these groups will receive 3% increases this month. Our instructional assistants and our clerical staff is not shown here, but our instructional assistants are. They will receive experience adjustments in April, so they'll see another increase in their pay. And then, as I mentioned, part of our adjustment this year and next year is to adjust our starting salaries by 1.5%. The custodial minimum will then be 11.04, as is shown here for this year. And something that a change we're going to make to our CNS workers. If you would have seen this slide, when you did see it earlier this year, our CNS workers were shown lower, but we're going to equalize our custodial worker pay with our custodial pay in terms of starting position. And you can see several other school divisions have done that. So we think that makes a lot of sense. So we're going to do that as well. So we are going to bring them to the new minimum and then do their 3% increase on that rate. With regard to minimum wage, and that's a question I know that some of our board members have asked about, when we finish the adjustments this month, we will have 35 employees whose hourly rate will be less than $11 an hour. And then with the salary actions that we're proposing to you this evening for July, all of our employees will be above the required $11 an hour minimum ahead of the January 2022 deadline. So, again, as I mentioned, this is work that we do every year. Salaries are important. Our staff is important. We can't do the work that we do without all of our staff groups. And so this is just indicative of some of the work that we do. And I think that, we're in a pretty good place. Still more work to follow. So another part of our employee compensation is health benefits. So I want to talk about that a little bit this evening as well. This graph shows our claims cost per member over the past 9 years with a projection for this year and for next year. So you know that we are self-funded for health care, and so our claims costs are really what drives the premiums, both that the school division pays employees' behalf and that our employees pay. So you can see that there's a few kinks in this red line, so it's not exactly a straight trend up, but it does slope upward over time, except for 2020. So we'll talk about that in a minute. But you can see that we have seen different rates of increase. So for on the notes on the left, you can see from 2015 to 2017, our claims costs went up only 2.7%, which was great. Didn't increase premiums for employees or for the school division during that time. Then from 17 to 19, you see that our costs went up by 13.9%. And then you see a 7.7% drop for 2020. So what happened? Well, the pandemic happened. And as we've talked about a couple of times this evening already, it's affected us in many, many ways. This is a way you might not have thought about initially, but you recall that it was difficult to get access to medical care for the first few months of the pandemic, and then some folks were a little reluctant to go and get elective procedures done. And so we saw a decrease in our 2020 cost, and we were not the only ones. That was kind of a national phenomenon. So we do know, of course, and we do know it'll come up for 21, and it'll come up again for 22. What we also know is that some of those procedures that were postponed will probably be done at some point in the future, and in some cases, kind of like car maintenance, if you put it off, sometimes the cost is greater when you finally have. That's true with us as humans as well. So you may see some increased costs for some of the procedures. So we've worked with our healthcare consultants to come up with what the projection is for next year, and that's what we're looking at for. Now, this is again. Let me just mention. I said this is health claims per member, and that means it includes dependents. And so for our folks that include their families, then each family member would be represented here as a member. So our projected cost for 2022 is $6,110 per member. And then, looking again at the notes on the left, we do expect that increase to cost $2.4 million, and we're proposing to cover 2.1 of that in the school division's budget, and we're proposing to increase employee premiums to total $300,000, and those increases would range $1.64 a month for our employees up to $33.12. And I have that, I think, for you on the next few slides. So what I wanted first to show you is what the school board's monthly contribution is to health care. So the school division provides the same amount of contribution no matter which plan is selected by the employee, but it does vary by level of coverage, as you can see. So we pay a little more for family than we do for employee only. So what we've shown here is what the school division is contributing currently in 2021 for each employee that's covered by level of coverage. And this is, again, on a monthly basis. And then what the plan would cover in 2022, and what the increase per month for the school division is over 10 months. So that's how the additional $2.1 million that I'm talking about would be, which would look on an individual basis. So it's a considerable benefit for our employees, and we haven't increased pay in a while, so we think it might be time. So let's look on the next slide what employee health premiums have looked like. And this is a shared cost plan, so the school division pays the lion's share, but employees also pay something. In 2016, we did a 10% increase, and that is the last premium increase that our employees have seen for health care. In 2017, because our family premiums were much higher than surrounding districts, we made a 15% reduction that was based on the input from our health consultant. And then, because we had very favorable experience, you saw some of that slow increase that I mentioned on the earlier slide. So from December of 2017 through February of 2018, we didn't charge premiums to our employees. We gave them a 3-month premium holiday. So that was a great benefit for employees there. The thinking was that we had a good fund balance that had been contributed to by both employees, and we shared some of that with our employees for those 3 months. And then in 19, 20, and 21, we did no increase. Now, we had planned to do an increase this year for employee premiums, but when we could not do a raise, we chose also not to do the health premium increase. Excuse me. Okay, Michelle. So this slide shows what these percentages would be that we're recommending for next year, as well as what the monthly increase amount would be. So this is shown by plan. You know that we have 3 plans, and we have several levels of coverage. So we've got all that shown here. So individuals, employees can pick the plan that they're on and what level of coverage, and they can see easily what their percentage increase would be and what monthly amount of increase would be. And again, these premium increases are over 10 months. So again, as I said, the rates of increase range from 3% to 6%. And remember that our last increase was done in 2016. It was 10%. So these are, lower rates of increase. And the amount of increase you can see for the Equity 3000 is $1.64 a month for employee-only coverage, and it tops out for the people that are in the point of service plan over on the right and that have family coverage at $33.12, and you've got something for everyone in between. So those are the extremes, the lowest and highest increases that we would see. So we wanted to provide a couple of examples of what that looks like on an individual level. So on the next slide, there we go, Michelle. Thank you. We have 2 employee examples. So one on the left is, this slide didn't format right. I'm sorry, it's a little hard to read, at least what I'm looking at is. But let me walk you through it anyway. So we have a bus driver with 6 years of experience who is in the Advantage 35. This is our HMO plan, and has employee-only coverage. So you can see, not as easily as you should be able to, that the March 21 salary for that driver would be $19,737.90. Is their annual salary. And the 22 salary, after a 3% increase, would be $20,330. So the increase in their annual salary would be $592.14. And their annual increase in premium would be $73.90. So the increase to the school board for this employee would be $610. So while we're asking the employee to pay a little less than $74 more, the school division is paying another $610 more for next year as part of that $2.1 million that we talked about. At the bottom of the example, you can see the new monthly premium for the employee is $130.83. We do offer a wellness credit of $50 a month for all of our wellness plan participants. About 60% of our employees participate. So if this driver were to participate, their monthly premium would be $80.83, again, for 10 months of the year. Just to let you know what the school division is paying for that particular employee would be $8,110 next year for that employee's coverage. So that's a great benefit, as I mentioned, for our employees. So just to give you another example, on the right, we have a teacher with 19 years of experience on a bachelor scale. This teacher would be in the Equity 3000 plan, their family. So this is our consumer-driven health plan, and it's partnered with the option to be part of an HSA, health savings account. So in this particular case, you see that the teacher's salary in 21 is $57,570. The salary in 22, again, now this is based on the teacher and where they are and what their raise would be based on the compression adjustments. Their 22 salary would be $61,414. So their annual increase in pay would be $3,844. Their premium increase on an annual basis would be $331.20. And again, as with the driver at the bottom, we've shown that the new monthly premium for this particular teacher would be $447.57. And if they participate in the wellness program, they get the credit, and they'd have a monthly premium of $397.57. And again, just so you know, that the school division would be paying $800 in health premiums for this particular employee. So that's what we're looking at in terms of compensation and health care for our folks for next year. And now I'd like to turn the presentation back over to Dr. Parker to review the additional positions that are proposed in our FY22 budget. Dr. Parker.
And thank you, Mary Lou. That was a very good overview of the impact of the raises, as well as the impact of health care increases on our employees. And as always, when you look at that from a cost of living standpoint, the bottom line is our employees will, on a monthly basis, have more money in their pocket next year, even with the health increase, than they would than they would this year. So that's very good to know that health increase does not impact salaries to that level. With that being said, the next portion of our budget presentation is on staffing. Every year we look at our needs-based budget, and we determine where to maximize the resources and personnel in our division to do the best and most impactful work possible. So in listening to our departments, our school leaders, various input drivers, our board members, we're looking at 21 positions that we need to add to our budget next year, for next year. Now, these 21 positions will not all have a budgetary impact, because some of our additions will be handled through attrition in our budget, as you'll see when Mrs. Russo talks about balancing the budget later in this presentation. Important to note that these are very purposeful additions, and I'd like to go through this information on each of these staff additions and the impact that we hope they will have on serving students. So we'll start with our school counselors. The state budget funds an additional counselor taking a ratio of 325 to 1. So the governor is asking for an increased ratio of school counselors in our schools. It looks like that 325 ratio to 320 to 1 counselor ratio is going to pass. And we've calculated that would require Newport News to hire 5 additional counselors. Now, that ratio, unlike in past budgets, that ratio is not a per level elementary, middle, high school ratio. It is a school division ratio. So as an entire school organization, the budget that's being passed at the state level will require that we have a 325 student to counselor ratio across our division. So most counselors are planned in the next fiscal cycle. We have been working over the past few years to expand our mental health team by adding licensed clinical social workers and psychologists. According to the VDOE, mental health care is needed in the schools to improve access to services in the same building. The Center for Disease Control and Prevention reported that 13% of children ages 8 to 15 had a diagnosable mental health disorder. The COVID-19 pandemic, as many as 1 in 5 children had a diagnosed mental health disorder. While research on the pandemic's effect on mental health is still in the early stages, current evidence shows among children and adolescents since the pandemic began, we can expect the numbers to increase significantly. We currently have students with a variety of mental health diagnoses across a range of mental health disorders attending our schools. And 50% of disorders begin before age 14, 70% before age 18. Okay, the average delay between onset of mental illness symptoms and treatment is 11 years, and that's very alarming. That was a very alarming statistic to know that a child could go that long before being diagnosed with a mental illness that needs to be addressed. 17.2% of students nationwide reported seriously considering attempting suicide. And early identification and intervention of mental health concerns can vastly improve school and life outcomes for students. In addition, almost half of all parents report experiencing higher levels of stress during this pandemic, which increases their children's risk of experiencing family adversity and related mental health problems. So given the extent of this information, we know that we got on this path a few years ago, adding clinically licensed social workers and psychologists, because we saw an increasing need for emotional and wellness support for our students in order for them to be successful. And I'm glad to say that the state is now going to support some of that staffing in the next state budget. So we'll continue to move forward in that direction to ensure that we have an adequate staff of mental health professionals. Next slide. In the area of student success, we really want to ramp up the work of our college and career readiness. Now, I can only point to one good example that we made significant gains a few years ago to show the value of putting the right people in the right place, and that was in the area of on-time graduation. A few years ago, our divisions invested in graduation coaches. We also continued to invest in additional counselors and supports. And we saw that our dropout rate significantly decreased well below the state average, and our on-time graduation rate almost went to the ceiling, exceed average. Investing in the right personnel in the areas of work-based learning and college career specialists will enable us to do the important work of making sure that we have an equitable approach to providing that support to all of our students. So we currently have part-time work-based learning specialists in our schools, our college career specialists in our schools. We're proposing to make them full-time in our high schools. And part of the work that they will do is they'll assist with creating a business advisory council, coordinating the efforts between local businesses and our 5 Newport News high schools. They'll lead the co-op coordinators. They'll work with our co-op coordinators in all 5 high schools. They'll support the 5 schools in finding student work-based learning experiences, ensuring all Newport News students receive the necessary requirements for graduation. They'll lead the effort of developing work-based learning simulations for students when local business is unable to meet the demand for our students. College and career specialists develop working relationships with college representatives nationwide, local military recruiters, and career pathway opportunities to introduce students to a variety of post-secondary options. And they facilitate individual visits between school-based on-site admissions. They also serve as the point of contact for scholarships awarded to students and work with several night programs and middle school counselors, serve on a variety of committees, and obtain the report. They also work in terms of our on-time graduation efforts. So making them full-time will be a significant benefit to our school division and also enhance the work that we are doing in terms of work-based experiences for students and always improving our work with college and career readiness. So we're looking forward to that opportunity if this budget, if that's supported in this budget. In the administration, last year, our Department of School Leadership identified a need for several of our schools for an administrator in training position, which would support our building administrators in various duties to include student discipline, instructional monitoring, and other assigned responsibilities. Administrative assistants serve as assistant principals in training and provide additional support to the school at the school level to the leadership team. In addition to supporting the principal at the school level, this position is a great way for teachers, counselors, and other staff who seek advancement within our school division to get an experience as a school-based administrator prior to being tapped to become a full-time administrator. In addition to the administrative assistants, we're also recommending that we add an additional an assistant principal, for Huntington Middle School to better prepare for the arrival of additional students to the Huntington Middle School program next year. So those are our staffing additions. In the areas of non-personnel related recommendations, we start with technology. Now, not surprisingly, now that we have advanced our division to one device per child, we anticipate having some increased technology needs in future budgets. However, because some of our immediate needs can be considered for funding through other sources, such as our ESSER or CARES Act funding, you'll see that from this slide here that our initial estimate of $2 million has been reduced to $1 million in this proposed budget this evening. In the other area of non-personnel priorities, operations and maintenance, we have ongoing non-personnel needs to fund this area. You may recall that our earlier estimate was in the area of $2.6 million. We're currently negotiating with the city manager at this particular point to see if some of these items can be considered for the city's a city portion of their budget in terms of cash capital. So you'll see that our initial estimate of $2.6 million this evening has been reduced to $1.4 million as we balance our budget. Okay. In this listing here of some of the projects that are included in this in next year's fiscal budget would be replacing bathroom renovations and canopy replacement at one school. We're looking at tennis courts and other surface areas. We have a need for upgrades to auditoriums. Some of their audio equipment is dated and at potential risk of failure at this point, so we have to replace quite a few of those systems. And then we have always continued to replace, for safety concerns, continue to work on our security cameras, PA systems, making sure we remove outdated systems and also systems that are near failure. So those were some of those funds would be. So at this time, let's go and look at the budget detail for the FY22 budget. I'll have Mrs. Rousseau give you an overview of the proposed revenue and expenditures for the FY22 budget. Mrs. Rousseau?
Thank you, Dr. Parker. So we want to look at our revenue. It really is a constraint with regard to what we're able to do. Based on what we know about the state revenue at this point, we do expect our increase to be $10.7 million for next year. You recall that of the governor's budget, the increase was $6.5 million. The General Assembly budget is much better. We did just get our calc tool from the state late this afternoon. We haven't had a chance to run that through our budget process yet, so we'll see what changes we may need to make between now and when we present the final budget to you for approval. Well, this is the final budget. When we talk to you about approval, we'll have to give you whatever changes we need to make at that point on the 23rd. But anyway, for now, we've used $10.7 million in increase from the state. That's a 5.2% increase in revenue year over year from the state. For the city, we have, as Dr. Parker mentioned, asked the city to provide some additional cash capital. That will be included in their operating budget and not ours. So it's not shown here as an increase in our operating budget. With regard to federal income, the largest part of that is impact aid, and I think, as I mentioned to you in an earlier meeting this year around the budget, we were fortunately able to submit the same cards for this year that we did last year. It took a little while, but we actually got started with the card process in the fall, and at some impact aid folks said you can stop that process and use your cards from last year. So based on that, we do expect our revenue for impact aid to be flat, and we're projecting the other federal revenue sources to be flat as well. And then other revenue, which is a long list of relatively small revenue sources, we're projecting to be flat again as well. So we're looking at a $10.7 million increase overall for revenue, which is a 3.3% increase over this year's revenue. And with that, we were able to balance the budget. Looking at how we did that, the 3% raise for all employees is at a cost of $11.1 million, and you might say, well, that's more than we typically expect to see on a 1% per 1% basis, and it is. You're right. And that is because the FY21 budget only included a 1% raise. And so the cost of the raises that we're doing now for this year have to get into the base. So that cost is included there. The compression for the teacher scales was another $2 million, as you can see. Positions which Dr. Parker just reviewed with you are 21 of them at a cost of $1.5 million. Also, as he mentioned to you, we do have turnover and attrition in our budget, $1.6 million in turnover and $4.7 million in attrition. And if you wonder what the difference is, here's how we look at that. Turnover is the savings that we see when a senior person leaves and is replaced by a person that makes less. And attrition is what we see when positions are vacant. So before they're filled or because they cannot be filled, we certainly have some of that in every budget. We've had a little more in this year's budget simply because we chose not to fill some positions during the pandemic because we didn't have, we weren't in school. And so, for example, drivers we didn't have work for some of our drivers. We repositioned them in other work, other positions. So we had a little more of that this year than normal. I mentioned the health plan cost of $2.1 million, so you can see that here. And the total cost really increase for health care is $2.4 million. We're doing $300,000 of that with our employees, so you can see that that's on the decrease side. And then cash capital for both technology and maintenance, as Dr. Parker reviewed with you, we have $1 million and $1.4 million for each of those shown there. And then in every budget, there's some one-time costs, and this year's budget was no exception. So there are a number of things totaling $1.8 million that we can take out. They won't recur. A lot of it had to do with the work that we did at the Aviation Academy as we moved it to Denby High School. And there were a few other things in there as well. Track replacement at Todd Stadium for a few $100,000. And we had a building capacity study for $109,000. So those things came out of the budget. And so then you can see that we had a net of $10.7 million in terms of increases, which our $10.7 million in revenue covers. So that is our balanced budget. So then to look at the slides that Dr. Parker started with, but updated for 2022, you can see our total budget shown here. Revenue, and as I mentioned, the state provides the lion's share of our revenue. You can see a little less than 2/3, and the city just a little bit more than 1/3. And then our federal and other revenue, really less than 2% in total. So that's what our revenue sources look like. With regard to our operating budget by functions and showing how the budget is actually spent, again, the lion's share of our spending is around instructional services, as you certainly expect, operations and maintenance, debt service, technology, transportation, all the other costs. You can see their relative shares. But it's really all about what we're doing for kids. And so 73% of our cost for next year is in instruction. And then one other look at it, and that is the look that Dr. Parker shared with you with regard to what percentage of our budget is about people and what part is about other costs. So you can see that our salaries for next year are 60% of our total proposed budget. Our benefits are 6%, so the people costs are 86% of next year's budget. And our non-personnel related costs are $48.6 million, or 14% of next year's proposed budget. And everything else is in that little green slice. It looks, it's $48 million. That's a lot of money, but there are a lot of things that get covered with that $48 million in our budget. So that's a look at our pie charts for next year's budget, and Dr. Parker is now going to wrap things up for you.
So in terms of next steps, we are expecting the board to have a public hearing on the proposed budget on March 16th. As I mentioned earlier, that and Mrs. Rousseau mentioned a few minutes ago, the state released their calc tool for their state budget this afternoon. So we will be processing that calc tool and updating our numbers. We do feel that adequate information to present a budget this evening that pretty much reflects the state funding that we will receive. However, if there are small pockets or any changes, adjustments that are needed, the board will have that information as we update our presentation information. We'll share that with the board and the community. So we would expect that by tomorrow we will have the budget posted, the detail of the budget posted online for our community review. and obviously provide comment if at the public hearing on the budget. And also the board, our board members, you will receive a hard copy of the detailed budget will be delivered to you tomorrow, so that you'll have that in plenty of time to review prior to the March 16th public hearing as well. The board, we will have a board meeting on March 23rd where we ask them to consider the approval of the FY22 budget at that time. And after that budget has passed the board, we will move forward with providing the city manager with that budget in time for her consideration for her budget for the city budget itself. We do expect that if need be, and we haven't determined a need at this point, I will confer with the city manager whether another meeting is needed with council at that time. So we did not include it on this slide. However, we always look will entertain any request from the city to go in and have some further discussion regarding the operating budget, our proposed budget, as they consider and weigh heavily their budget priorities for the city's final budget. So that's what's upcoming for the community. You should expect a detailed budget, detail of the budget online tomorrow for your review if anyone wants further detail. And as always, we look forward to answering any questions that the board or our community will have in the coming days. So at this time, Mr. Chairman, I will conclude the presentation and open it up for any board members if you have any questions.
Thank you, Dr. Parker. All right, board members, are there any questions? Yes, Mr. Hunter.
I'm just going to say just thank Mary Lou for a phenomenal presentation and very detailed. And a great job, Ms. Mary Lou, on the detail and those examples that you gave as it relates to those getting raises and the increases in their insurance.
Thank you, Mr. Hunter. I'd be remiss if I didn't share that with the staff behind me who puts it all together. I want to thank Scarlett Minto and her budget staff, Irene Lopez and Sue Tutone, and also want to thank the HR staff who supports us with the compensation work, Sid Strong and Stephanie Hawes. I want to thank them as well.
My thanks go out to all of them. Thank you very much.
Thank you, Mr. Hunter. Other board members? Yes, Ms. Searles Law.
I just had, well, first of all, thank you. Definitely. It makes us feel so well informed to have such a competent team sharing the budget with us. So thank you for that. Of course, in this technology age, my audio cut out just at one point, and I was very interested in hearing that response. And that was regarding the graduation coaches. I know that we're taking them from part-time to full-time. Would that be all of our graduation coaches, or are there specific ones for specific populations?
Okay, thank you for that. We actually use the graduation coaches as an example. So they are full-time individuals. I use that as an example to show how we invested in specific personnel, specific outcomes. We currently have our college and career specialists at each high school, our part-time employees, and in this budget, we would like to move them to full-time personnel. Similar to investing in personnel for a specific purpose, which is to ramp up our work in terms of getting kids work-based experiences and to work on their career readiness as well as college readiness, which is what they're focused on right now.
Okay, that will provide for a data for us to assess that point. So great, thank you.
Thank you, Madam Vice Chair. Other questions?
I just want to give them a thanks. Thank you, Mary Lou, for all the hard work, and Dr. Parker and your team and staff. So I'm just ready to solidify this and move it on to the next level. And I hope our counterparts, see all the great work that you guys always put in. So appreciate that. Thanks.
Thank you, Mr. Harris. All right, seeing no other questions, and we will move on to item 3 on our agenda, which is comments by the superintendent. So, Dr. Parker, the floor is yours.
And I'll be brief. I just want to say thank you to a lot of hardworking staff members, many who are on this call today, our principals who we are very proud of, and assistant principals in visiting schools, these past few weeks, I can tell you that if you ever want an example of the mission of educating children, seeing our teachers return and our administrators welcoming students on the first days that they come back, making sure that they're working through a lot of the details, many of the details that we have wrestled with over several months, just come to fruition, knowing everything will not be perfect, but the willingness to continue to push through the challenges. I'm just so proud of the folks that we employ who are on our team and who are serving kids. And I just want to say thank you. I sleep very well knowing that I have competent professionals in Newport News Public Schools that are doing the heavy lifting every day to make sure our nurses, our school nurses, the clinics, our cafeteria staff, and every building right now is shining just beautiful inside. Our custodians and just our bus drivers who are working, everyone is just moving the mission forward. And we know that we're going to have challenges moving forward, but it's the right work at the right time for our children. And I want to thank everyone for that. To our board members, thank you for your consideration of this budget. As always, we want to present a needs-based budget for our community that we feel will continue to push our mission forward in terms of our strategic plan and enhance the work that we're doing in our school division. And our goal, that we've always said, college and career readiness. So our goal is to put the staff there, the resources there, and the structure there to make sure kids are leaving Newport News, not just graduating on time, but graduating for employment, starting businesses, going to college, whatever, military, whatever their plans are. We want to have the resources in our school division to make sure we can make that happen for them. So thank you for your consideration. Look forward to the board's consideration on March 23rd. And thank you, Mr. Chairman. That concludes my remarks.
Thank you, Dr. Parker. So with that, we will get ready to close out our meeting. As a reminder, you heard tonight, March 16th will be our public hearing. This now moves us into the phase with the public. As much interface and feedback as possible. As Dr. Parker mentioned, please go online and review the budget. The budget is going to be on our division website for the public to review. And as well, we look forward to seeing you all next week, March 16th, to get your feedback on the budget. And of course, March 23rd, the board will vote on the budget. So now is the open review process so the public can review what is taken shape and make their comments. So please take advantage of that. And so with that being said, we will now close out the meeting. I will thank you all for tuning in, and we'll see you all next week.